So prior to arriving at the ERS, I looked through the programme, and the important areas that are always done well at the ERS is home non-invasive ventilation. There's a number of sessions which focus on the management of patients in the home environment with chronic respiratory failure. These are going to be the highlights that we see at the ERS this year.
I'm really impressed by the topics. Lung inflammatory disease means all the inflammations that occurs in the lungs and the respiratory system at large, and how we can reduce the auto-injury that our body produce against the lung when the lungs is injured. This is not clear, at least when we have to stop where treatment we have to apply, and if this inflammation is good or not. So maybe this is a really hot topic for the future.
So I love coming to the ERS because it's full of people from all around the world, and it's the most attended from all respiratory physicians and other related professionals. And it's always great to meet friends here coming from Italy or from other countries that they met before, and exchange opinions about the new therapeutic or treatment proposal that emerge every year. It's a great place.
The first highlight was going to the Nelson lung cancer session, learning about how the lung cancer screening process is happening in Europe across European centres, and learning more about the data from the study of screening in lung cancer, people at risk of lung cancer. So I was very interested about that, because probably in Australia we're about to undertake similar things. So I think it's a really informative session that I went to. And then the other highlight was actually the session I spoke in earlier, because it was so full of really fantastic clinical trials that are really paradigm shifting studies. So in the interstitial lung diseases, the use of antifibrotic agents across a whole spectrum of different diseases has been shown to be very helpful in slowing disease progress. So I think this is a really exciting time in interstitial lung disease, not just from the diagnostic point of view, but also from the therapeutic point of view.
Actually, I think the thing I took home yesterday, but that was a psychologist from Leuven who he presented psychological approaches to perceived dyspnea, and they were actually investigating perceived dyspnea and how the signal worked in the brain, and I thought that was pretty neat and pretty interesting, because I think I realized that's the connection between the perceived dyspnea and the signal that how it affects the physiology. But that was the take home. I think, that would be a pretty nice study to do in terms of investigating dyspnea and look on brain signals. So, but it's not my expertise of area.